We are with Bethany this second morning after surgery. How are you?
I'm doing pretty good.
Yeah. So Bethany is 52, and day before yesterday, we did for her a deep neck lift, deep clean extended facelift, lower blepharoplasty, upper blepharoplasty, full face laser resurfacing, brow lift, and very importantly, a sprinkle of fat transfer basically everywhere, from the temple all the way down into the jawline. How have your first couple days been?
They haven't been too bad at all. I haven't had to take any extra pain pills. I've slept great.
So, first part of what she said is pretty common. We prescribe everyone Celebrex, which is like naproxen or ibuprofen. It's not narcotic, but it doesn't cause bleeding, so that's wonderful. And Tylenol. Celebrex and Tylenol is the baseline. That's pretty much what people take. Once in a while, people need a true extra pain pill, which she didn't use. The second part of what she said is not normal, that you slept great the first couple days. Most of my patients, they just don't sleep. Between either traveling or anesthesia hangover, having good sleep the first couple days is really rare. So good for you.
I thought it would be hard sleeping flat on my back,
Yeah,
but it worked out fine.
good. Have you had any nausea since we
No,
started?
no, that anesthesia that I had was perfect. I woke up feeling great. I haven't had any nausea.
Bethany is actually an anesthesia professional. Did you have any thoughts about? It's weird when you're at the other end of it, right? What were your thoughts leading up to it? What were your thoughts during it and after? I'm curious from an educated consumer standpoint what you felt the process was like.
Well, I did my research to find you, so I knew I was in good hands coming here, and you can just tell that you've chosen all the right people. Everybody really knows what they're doing. They're so kind, and when I got led back to the operating room,
Would you get me a gauze? Maybe a little drip.
it looked just like any other operating room I've been in. It was clean, it was perfect, and the nurse anesthetist who took care of me, I couldn't have asked for a better person.
Well, thank you. You got a little drip. So this is not uncommon. We just took a couple stitches out behind Bethany's ear. This is not blood. It's kind of serous drainage. Whenever you take stitches out, sometimes you get a little weepiness afterwards. So I apologize for that. Yeah, well, that's good. Turn towards me. Let's let everyone see what you look like. So Bethany had some modest looseness. She actually looked really good in the lower face neck, but we did make that, I think, even a little bit better. She had real deflationary changes in the middle part of her face. That's I think one of the bigger changes that we did with rebuilding that using your own living fat. So that'll do really well. We also opened up her brow, cleaned up her upper lids, and I was telling her, feel free to face the camera.
Okay.
I think you're going to look 15 years fresher is the best way of saying it. Yeah, the goal is younger, but honestly, it's more vital, more energetic, uh, healthy, awake, bright, and that's 100% what you're going to get.
That's just what I wanted was for the outside to match how I feel on the inside.
Yeah, that's a great way of saying it. Well, good. Well, thank you for letting everyone check in with you on your second day after surgery, and we'll see you back in the next several days, and hopefully we'll keep everybody informed.
All right. Well, thank you.
We are day 5 with Bethany today. How are you?
I'm doing great.
Yeah, it's her stock answer. I'm doing great. So 5 days ago for Bethany, we did a deep neck lift, deep plane facelift, upper and lower blepharoplasty, brow lift, a tiny touch of lip filler, which I forgot to mention last time, full face laser resurfacing, and a little sprinkle of fat from the top of her temple all the way down to her jawline. Bethany, how old are you?
I'm 52.
52. Okay,
Hmm.
so about my age. Um, What part of this first few days has been the most irritating,
Um,
besides having to do these videos?
I, it's hard to come up with anything that's irritating. It's all just been so smooth. Just like you've done it once or twice before. It's just like this well-oiled process, and but yet I feel like you see me and you're treating me like,
Well, thank you.
you know.
Yeah, so I mean, it is. So, a couple things. What most people say is the most irritating is funny. You said well oiled. It's the grease. That's what most people say is most irritating about this process. Is if we do the laser, just the grease that we use to preserve the moisture inside the lasered skin. That ointment can just. It's not irritating physically. It's just
It's everywhere.
it's
It's
everywhere.
on the chair. I just looked
Yes,
at it. Yeah.
exactly. But then the other thing he said, yeah, this is my bread and butter. This is what our team does is facial surgery, and especially nowadays more of the aging face restoration surgery. So yes, we've done a bunch of them, but yes, every single person is individual and gets individual decision making, individual attention, all that kind of stuff. So you said you'd lost a little bit of weight shortly before the procedure, or over the span leading up to the procedure.
Yeah.
Do you feel like that impacted your facial shapes?
I wonder if maybe it did, that I just looked a little deflated just because of losing a little bit of weight.
Yeah, I think that happens. So I think we do see deflationary changes in the middle part of the face, especially with weight loss. And as the face deflates a little bit, that slack it all piles up in the neck. So your actually jawline and neck were actually still really, really good. I feel like we had more improvement on you in the upper half of the face.
Oh, yeah.
Although your jawline and neck were really, really good, they're going to be super triple good now. Like they went from here to here. One comment we got a lot on the first video we put up about you is about your earlobes and your ears. What do you remember the types of comments they were saying?
Oh, yeah. Her ears are so low. They're so big. Will they stay that way forever?
So, um, incisions were made around the entire ear. That's where we hide the incisions to be able to do the face neck lift part. And so that little island where the river goes around, that little island swells. So it is totally normal for the ear and earlobe to get swollen and just kind of look. Actually, there's swelling behind the ear because I work extensively behind the ear, and the swelling behind the ear rotates them forward temporarily as well. So that's another. Sometimes a patient will notice that themselves. They'll say, "I feel like my ears are more rotated forward." All of that settles out. They go right back to where they started with their intrinsic quirks. You know, if someone starts with one ear, it's a little more rotated before we work on them. At the end, they land exactly there. Go ahead. Were you going to say something?
Oh, I was just going to say that overall, though, the comments were so supportive, and I really enjoyed how kind everyone was. It's kind of fun to just get the encouragement. So,
Yeah. And this is, it's life online these days. There's trolls out there, but what I've been really lucky with is like with yours, I'd say there's probably what 300 good ones for every one idiot.
oh yeah,
Yeah.
yeah. There's
It's not even like a 1% rate. Like people are on your team. They're very excited for you.
well, and I just think, well, maybe that person misunderstood, or they're having a bad day, because really, I just feel great about all of this and so appreciative.
Thank
So,
you. Face this way. I want people to see what you look like because I would just show your brow, cheeks, neck, jawline off all day long. I mean, to me, this is exactly what you should look like. Just looks like you. Also, lips turn that way.
oh,
So I don't do filler as a standalone anymore because I spend most of my time in the operating room. But very commonly during surgery, we'll do little bits of filler, and so we did a tiny touch of age-appropriate lip filler, I call it.
oh, I love that. I was just trying to think today what my very favorite part was, and I just love everything. It's really hard to narrow it down,
Well,
but I do love the extra bit of lips
yeah.
too.
I think my favorite part is the synergy when we get to do everything in the right measure in the right way. I think that's my favorite part. Anything else you want to tell these guys about your fifth day? Oh, Ativan. Tell them about your Ativan.
Oh, well, I've been sleeping great the whole time I've been here. And I think maybe part of it is that I have taken the Ativan most nights, and it just helps, I guess. I sleep wonderfully.
Yeah, better living through chemistry. So Ativan is related to Valium, is related to Xanax. It's not a narcotic, but it's a benzodiazepine. It's a kind of relaxes muscles a little bit, which is nice for the tightness that people feel, and it also kind of slows your mind a little bit. So it's like a cocktail in a glass in a
Yeah.
pill, basically.
Yeah.
Yeah. Well, good. Well, thank you for letting everyone see how you turned out on day 5, and we'll keep them informed.
All right. Thank you.
You're welcome.
I am here with Bethany, post-op day 7 from having surgery with Dr. Nyack. And Bethany had Dr. Nyack do a deep plane facelift, a neck lift, brow lift, upper and lower eyelids or blepharoplasties, a full face laser, and a little bit of conservative lip filler there. So I cannot believe how amazing you look.
Well, I'm so happy. I feel great, and I just am just ecstatic with the job that he did for me.
It's amazing. She's one that makes my mouth drop, my jaw just drop. I will look at your before pictures when she comes in, and I can't believe the transformation. I mean, to me, it seems huge. Even though you still look like you, it's just you have had that clock turned way, way, way back. You look like a teenager.
Oh, and you know what? It's even better than I had hoped for. I just feel so thankful.
Yeah.
So,
Oh, I'm so happy for you. How has this journey been for you so far? Like pain? You said not much pain.
no, I haven't ever had to take any of the pain pills beyond the regimen with the Tylenol and Celebrex.
Yeah.
Um,
Never took the strong one, the
No.
Dilaudid.
no.
That's what most people say. We give it to you just in case, but most people don't need it. And that blew my mind. Even with me having surgery, I thought, how are you not having pain? I've seen this surgery done. How are you not? But most of our patients, not everyone, but most of them say not that painful.
I'm shocked too when you think about all the manipulation and that it just really isn't that painful. The ice feels amazing though.
Yeah.
I haven't had pain, but the first couple of days I was very tired. I'm always on the go and just I thought I was going to have surgery and then just boom, get up and carry on like normal the next day. And woo, actually I was pretty tired. I napped a lot the first
Yeah.
couple days.
I think people underestimate elective surgery. They think, oh, it's elective. I'm not sick. I'm going to go and have it done and come back and just jump right back into life. And it's a little more, like I said, not pain, but just exhausting. You're tired. Your body still has to heal from all this. So you experience that too, just tired.
Oh yeah. Yeah. At first I thought, why do I have to be there for 10 days? I've got things to do and a life to live, but I'm really grateful for the excellent care, follow up, and honestly the time to just rest.
Yeah, a little break from life.
Mhm.
I get it. Well, tell me this: when you look in the mirror at home, what do you think when you look in the mirror first? Is it shocking to you, or is it like, oh, are you still not figuring it out yet? Or
I mean, it does look different.
yeah,
But I don't feel like it's crazy. I feel like it takes me back to how I used to look.
yeah,
Um, it's really something that when I scheduled the consultation, I really just wanted my brows lifted. But
Oh,
Dr.
interesting.
Nyack, looked at the whole picture and there was never any pressure, but he said, here are some other things you might want to consider. And I'm so grateful for his artistic vision
right.
to pull it all together because I feel like I'm so much happier than I would have been with just getting my brows lifted.
If you had just had your brows lifted, I can guarantee you, then you'd get home and be on to the next thing that was bothering you, probably.
Yes.
So it is nice to have someone to kind of say, these are just thoughts, and you don't
Mhm.
have to do it, but puts the thought there, and then if you want to go with it, go with it. And if not, not.
Yeah.
Yeah. That's awesome. He doesn't push anything on people. If he doesn't think you need it even and you want it, he still, if he doesn't think it'll make much of a difference or be worth the recovery or the risk, he won't do it. So
Yeah. I had mentioned at the last minute before my surgery, like, well, we're doing all this other stuff. Should we do something to my nose too? And he
Yeah.
was like, no, I think you've got a good nose.
You do.
It'll be fine.
and you
So,
noticed a little bit of change with that afterwards
yeah,
too, right?
Yeah, I'm super happy with that unexpected little lift.
Yeah.
Just then.
I love it. I love it. What else do you want people to know on day 7? You're halfway through your recovery period here in St. Louis. So anything you think people should know maybe coming into this or something that's helping you recover at home?
I think it's really important to have a support person with you because you are so tired that it's really nice to have somebody to help just do the vinegar soaps and the icing and just help you along the way and be
Yeah.
a little cheerleader.
Get your chores done.
Mhm.
Well, let's show people how you look today.
Okay.
So we want to go, let's see, let's go ahead and turn towards me, maybe.
Okay.
Yep, and let's show this side here. So shapes are phenomenal. Front view, you can see immediately. These shapes, though, are already great. And going to get better even because you still have swelling on board, but not crazy swelling.
I can tell a difference. Like I can tell everything is just coming down with the swelling. It was pretty tight in the beginning, but
Yeah,
yeah.
it improved. And then she's already, looks like she's peeled from doing her laser. That peeling's already done. So we've told her today, you can turn back around.
Okay.
We've told her today that she can switch from using the vinegar, vinegar soaps and the ointment to switch now to the more nicer lotion. and the facial wash and lotion. So she's excited about that.
Oh, yeah, I'm excited not to have such greasy hair.
Yeah, exactly. Okay, well, thank you so much for sharing your journey. People are following and they ask about you, so it's nice to give an update.
Well, I appreciate all the kind comments everybody has been giving me, encouraging me along the way.
Yeah, that's right. It's really sweet. It does mean a lot. So thank you.
Well, it's day 8 for Bethany. How are you?
I'm great. How are you doing?
Stock answer. She's always great. So I'm doing great too. It's been 8 days since we did for Bethany a deep neck lift, deep plane facelift, upper and lower blepharoplasty, minimal incision brow lift, tiny touch of lip filler, fat transfer from here to here, and full face laser resurfacing. How have your last couple days been since I saw you?
Every day just gets better. Just the swelling's going down and parts of my face are waking up and I just feel great.
I did salivary gland reductions on Bethany. I wasn't sure if I needed to or not, and I feel really bad because the morning of surgery, I thought I don't think I need to. And we talked about all the delicious restaurants we have. St. Louis has an embarrassment of fantastic restaurants for a city of our size. And then after surgery, I said, you know, because when I went into the neck, they really were going to be not. They were going to stand between us and this result. And so I did reduce the glands. What this means is the salivary glands should be so small that they sit within the confines of the mandible. It's like having a cup of flour where the flour doesn't heap up over, right? Well, when they're super big, they bulge below the confines of the mandible. As in my case, here they are, right? So you need to level the cup of flour off so you can see the beautiful edge. So I actually ended up doing that. And so, what have you been eating since you can't have super spicy, super salty foods?
Ah, and I love food and I love all the flavor. I was so looking forward to the Indian restaurant and the Mexican and Asian, but cottage cheese, um, ice cream, um, grilled chicken, just really eggs.
Yeah. So, as a general rule, we tell people we want them eating foods that would not irritate a cold sore, not a cold sore, like a canker sore or a cut on the inside of your mouth. If it's something like lemon juice or super salty or super spicy, and it would make a cut or a sore on the inside of your mouth hurt more, it increases salivary flow, and it wouldn't be good for these glands while they're healing. Or if it's super dry, like saltine crackers or something like that, where it needs a lot of saliva to process. So for the first several days, actually first 10 days or so after this kind of surgery, we ask our patients to be on a gently flavored, not super dry diet. Um, Last thing I want to ask you before I show off your results one more time. Bethany's been on operating rooms for 25 years. Is that right?
Yes.
And I want to brag. You mentioned 2 things about our OR that impressed you. What were the 2 things you remember?
Well, your bed is amazing. The OR table, I've never seen anything quite like it. It was super comfy, and usually they're bulky and not comfortable, but that bed was that bed was very nice.
Yeah, we have a super ridiculously expensive custom operating table from Germany, but our patients spend anywhere from 3 to 8 hours on this bed. So it's super important that the bed is really comfortable. It positions for your back, it positions for your neck. It's cushioned appropriately. It takes all the pressure off your pressure points. So that's really important. It's also important that the bed manipulates in positions so that I can see what I'm doing without wearing myself out and putting myself in terrible positions. So it's a great investment. Actually, got the exact same bed for Dr. Kachari. His operating room's got the exact same bed too because it's important. It's whether you're doing face surgery, body surgery, or a young surgeon or an old surgeon.
Oh yeah,
And
I woke up feeling great.
yeah,
I wasn't stiff or anything from laying there for hours. It was a great bed.
good. And then the other thing is you said you thought it was clean.
Oh, just immaculate. Like I've been in a lot of operating rooms. This was it was outstanding just how immaculate and also well prepared, especially just, for being in an office. This was as nice or better than a lot of operating rooms that I've been in.
Yeah.
I felt really safe being there, like they could handle anything.
So we are really spoiled. We get to have the budget to have whatever we want. So we have duplicates of every instrument. We have 3 or 4 or 5 of every single thing we could possibly use. All the consumables, if it makes it just a little bit better to use a $700 spray of fibrin glue, well, we're going to do it. So we have the luxury of, we're not constrained by, the payer only pays this much per RVU, per whatever, and you're, squeezing blood out of a turnip. If we can make it better, we're in a real lucky position. So our operating room is stocked, like Erewhon. We're not Aldi, we're Erewhon. So yeah.
It was really fantastic. I was very impressed. As I think back through the week, that's one of the things that stands out, that I just knew when I walked in there that I was being well taken care of by people who knew what they were doing and cared about. I felt cared and looked out for. And also, the environment couldn't have been better. Like, it was just top notch. Everything was just as I could have hoped, or better.
Well, thank you. I really appreciate it. Turn this way. I'm gonna do one quick look at your, the gland part. It would have, if I hadn't treated her glands, she wouldn't have this razor sharp. It would stop right about here, and then she'd have a bulge. So by treating the glands, by leveling off the upside down cup of flour, you can see the edge of that cup really sharply, and you can see sculpted shapes all the way back through here. And that's the difference if we kind of go, I don't think we need it. Now, that doesn't mean we can get this exact shape on everyone, even if we do treat the gland. But if it's necessary, it improves the odds that we get that degree of definition out of there. All right. Thank you for letting them follow along. I really, really, really appreciate it.
Yeah, thank you so much. Couldn't be happier. I'm ecstatic. Thank you.
You're welcome. I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.